Greetings to all participants. Before I begin, I would like to just thank AIT and UN Environment for this opportunity to speak with you all on this important topic. Let us start our talk with the outbreak in Wuhan, China. Healthcare waste volume has quickly multiplied almost sixfold in Wuhan during the first few months of the outbreak. The authorities there recognized the need to safely manage healthcare waste in order to protect the wider community, as well as patients and healthcare workers themselves. Because although healthcare waste typically contains a lot of non-hazardous material, it also contains infectious agents, sharps, chemical waste, and may even contain radioactive waste. Wuhan managed the situation effectively with strategic use of stationary and mobile disposal units, mainly incinerators, also with co-processing of healthcare waste with municipal solid waste, again, that was mainly through incineration, and transport to neighboring cities for processing. This too was mainly through incineration. What was the experience elsewhere in Asia? Well, very little published data are available at present on waste generation rates during the pandemic. This slide shows some data, which I've been able to gather from various sources. As you can see, the figures vary very widely, and the reasons for such large variations are not yet explained. The World Health Organization foresees a comprehensive report on healthcare waste management during the pandemic sometime next year, in 2022. At that time, we will have a better understanding of how the pandemic affected the generation of healthcare waste and its management. But WHO does not have a good handle on this yet. Here we take a quick look at Indonesia, a large middle-income country. Indonesia's short-term strategy is to accelerate the licensing of hospital-based incinerators. In the medium term, Indonesia plans to construct central incinerators for healthcare waste in 5 provinces. No doubt there is a sense of urgency here driven by the pandemic, but some may express concern over the environmental impacts of incinerating healthcare waste, which typically includes large quantities of plastic. Plastic products cause environmental impacts both when they are produced as well as when they are disposed. Incinerating plastic causes emissions of greenhouse gases and a number of toxins, which together contribute to global warming, as well as the pollution of air, land, and water resources. Similar impacts result from the very production of plastic, which itself is derived from petroleum, and whose production depends on the combustion of fossil fuels. At the other end of the spectrum, we have a country like Laos, PDR, which is a low-income country, relatively small in terms of size and population. Laos Ministry of Health has launched the Safe, Clean, and Green Hospital Initiative, which takes a comprehensive approach to address a broad range of environmental issues in hospitals, including promotion of the 3 Rs. 62 hospitals currently participate in the Safe, Clean, and Green Hospital Initiative. Laos' national healthcare waste regulations require segregation of waste at source and recycling of materials, and ban incineration of healthcare waste in central and provincial level hospitals. What I like about this approach is that emphasis on segregation of waste and on recycling and the ban of incineration. But I also like the idea that rather than treating healthcare waste as a vertical program, it is integrated as an element of a wider program aimed at making hospitals safe, clean, and green in every sense of those words. Now, let us do a reality check. It is often stated in the literature that up to 85% of healthcare waste is non-hazardous, but is that always true? This slide shows the findings of waste characterization study in a general hospital in Vientiane. In principle, 73% of this hospital's waste should be non-hazardous. But because of poor waste segregation practices at source, the non-hazardous portion actually drops to only 50%. You see, the moment that any infectious or other hazardous waste is dropped into a bin containing general waste, the entire contents of that bin must be considered to be hazardous. This happens frequently in many healthcare facilities throughout the region, and it creates an obstacle to recycling. How important is it that hospitals should practice good segregation of waste at source? Firstly, let us consider that up to 70% of a hospital's waste may be plastic. That was the finding of a study by the NGO Healthcare Without Harm in 2019. That was pre-pandemic. Now, because of the pandemic, even more plastic is entering hospitals' waste streams. Wherever there is poor segregation of infectious waste from general waste, the result will be that large quantities of plastic are mixed with infectious matter. This creates an obstacle to recycling of plastic. Plastic that has been mixed with infectious waste can only be recycled if it is first sterilized. Let us now consider WHO's guidance on this matter. WHO has issued a guidance note addressing wash and waste in relation to the pandemic, and a few important points may be mentioned. Firstly, there is no evidence that handling healthcare waste has resulted in transmission of COVID-19 anywhere. Waste from COVID-19 facilities is no different than waste from any other healthcare facility. And the conclusion is that additional measures are not necessary beyond WHO's standard guidelines for safe healthcare waste management. WHO, together with other agencies, has issued this decision tree for treatment of COVID-19 waste. This may be difficult for participants to read, but it starts at the top with the segregation of non-infectious waste from infectious waste at source. That is fundamental. From there, the preferred treatment option is on-site treatment using best available technology, which we will speak about in the next slide. If that is not possible, the second option would be best available technology in a central treatment facility, and so on down the line. There is a lot of detail here that we do not have time to go into in this webinar, but participants can study the diagram more carefully when they see the handouts. Now, according to WHO, the preferred treatment technologies are autoclaves or high temperature double chamber incinerators. However, I want to make a point here about these two technologies because there is a lot of disagreement among practitioners regarding which technology is more suitable for developing countries. Personally, I've seen in the field quite a number of incinerators installed to support immunization programs, and autoclaves that were installed during the avian influenza and swine flu pandemics a few years ago. Many of these units quickly became inoperable due to poor operation and maintenance practices. Today, they are useless. These are wasted capital investments. And I say shame on us all if we repeat those mistakes in responding to the COVID-19 pandemic. We face a serious challenge to put in place systems to ensure sustainable operation and maintenance of facilities over the long term. And that is a fundamental need regardless of which type of technology is employed. And this is the point that I would like to emphasize. Here, I would like to make a few recommendations for management of plastic and healthcare waste during pandemics. For hospitals, it is fundamental to train all healthcare workers and strictly implement waste segregation at source. Secondly, I would recommend that hospitals consider sterilization of wastes over incineration. That is in order to reduce environmental impact. But either way, take steps to ensure sustainable operation and maintenance of the treatment units. Thirdly, please consider reusable PPE. Reusable PPE is available on the market. I think another speaker has addressed this. And it is more economical over the long run. Of course, it must be properly cleaned and disinfected prior to reuse, but reusable PPE can significantly decrease the amount of plastic in the waste stream. For households, we should encourage the use of reusable face masks. These also must be cleaned and disinfected periodically, but they're economical over the long run, and they help to reduce the amount of plastic in municipal waste streams. If single-use masks or gloves are used at home, they should be destroyed before disposal in plastic bags, enclosed and tied tightly, but they should be destroyed in order to prevent possible reuse. In the medium to long term, hospitals may consider other recommendations. Again, I come back to the point that hospitals should strictly maintain waste segregation at source. I cannot repeat that often enough. It is so important. Hospitals should conduct healthcare plastic audits. Healthcare Without Harm, as you know, has an excellent toolkit to assist hospitals with doing that. And on the basis of the audits, develop and implement strategies to reduce, reuse, and recycle plastic waste and other recyclable wastes. In the long term, a longer term strategy may be to develop a comprehensive healthcare plastic circularity strategy. But the important thing that I think to keep in mind is to get started by doing something. In closing, I wish to acknowledge colleagues who contributed information for this presentation. Their names are shown here in this slide. And I thank everyone for their attention. Thank you very much.